Hi, I'm Dr. Martin Rutherford. I am a board-certified chiropractic physician. I'm a certified functional medicine doctor, and this is
Dr. Randall Gates. I'm a board-certified chiropractic neurologist as well as being a chiropractor.
We work here at Power Health. I'm going to get rid of this. I've had a little bit of a cough, so let me get rid of it. Right, got rid of it. And Power Health has been here since 1980, and we have together forged our disciplines together, and ultimately, almost by accident, developed a chronic pain practice in which we treat a number of chronic issues. Some of those that you would be familiar with, that would be most familiar with, would be fibromyalgia and peripheral neuropathy and chronic fatigue and restless legs, dizziness, vertigo, balance, migraines. We'll be hitting some of those today because the topic today is going to be lysine and its antiviral properties as it relates to potential in helping herpes simplex, chronic fatigue, and vestibular neuritis, a subject I'm sure is on the tongue tips of everybody every day.
Yes, exactly. Yeah.
So, but we have several hundred hours online. We're trying to pick out very specific topics at this point that people have shown interest in. And frankly, this is a topic that I have a lot of interest in relative to the viral issues. And viral issues are always very vague to me in the patient's mind. Pretty much once they get a viral problem, they figure they're done, or they wonder if there's any drugs for it, or and we do a lot of chronic fatigue. It's pretty much anybody comes in here with a chronic pain problem checks off the box chronic fatigue. And we see a lot of Epstein-Barr virus, see a lot of cytomegaloviruses. So this is in the workup that we do for someone who has an immune problem or a fatigue problem. And we're going to be talking about both of those today, apparently. Viruses generally come up and people kind of are like, was there anything that could be done about it? So you're going to get the answer today.
Exactly.
So lysine, we're going to talk about lysine, and I'm not sure the lysine versus arginine. I kind of have a little bit of an inkling of where that's going, but let's talk about lysine. We use it a lot. And so let's talk about it. It's an amino acid, I know that.
Yeah, so lysine is an amino acid, and it's commonly been talked about in use of treating herpes viruses, basically herpes outbreaks. For all of you who know, who get the oral herpes or the genital herpes, people will frequently say, take lysine. And there have been many anecdotal reports through the years regarding the efficacy of lysine for this issue. So that's what really lysine is, and we're going to get into today how lysine may have some pretty profound implications in treating not only metabolic diseases, but also neurological diseases that we're observing, things we're seeing in the last 2 weeks. Now, with a lot of these touted antivirals, in terms of natural products, some people will basically say, oh, you need to take this, you need to take that. Well, we have the luxury of basically running research studies in our office and seeing what works and what doesn't work. And so that's why we're doing this broadcast today on lysine, because we have observed some astounding changes with the use of this.
We were using the distilled coconut.
Right, yeah, Lauracidin, which works.
Which works.
Right,
we're not, for all you Lauracidin fans out there.
Yeah.
But again, you get sick people, you get a pretty consistently successful result, then you run up against a case where it's like not happening, it's not working. Dr. Gates goes and does the research, and we're not using anything that's going to help that's going to hurt anybody, for the most part. And so we have the latitude to try some things out here. And I'm as anxious as you to hear about this, because sometimes I don't hear about these things until we're sitting right here. So I understand lysine, and you have a topic down here called what foods contain lysine versus arginine. So that's a little bit of a skip to what's arginine, another amino acid, and another thing that has been told that you can be used for different types of natural problems.
So yeah, let me kind of combine the next two. That'd probably be the best thing.
Okay.
And so Really, we found out about lysine in 1964. So it's been known for quite some period of time, at which point a researcher did a study where they were looking at how viruses replicate, and it was a herpes virus. And this researcher found that when the medium in which he was growing the virus had basically a lot of lysine and low arginine, that the virus did not replicate. So the lysine arginine ratio. Versus when there was a lot of arginine and low lysine, that's when the virus replicated the best. So that was really discovered in 64. And we'll go through kind of what happened in the 80s and today in this research. But that's the framework. So then basically we want to look at what foods contain a lot of lysine. Those foods are more meat-based products, fish, cheese, things of that nature. The foods that contain a lot of arginine are more soy, almonds, nuts, wheatgrass, things of that nature, foods of that nature. So that's the lysine to arginine ratio that really needs to be talked about.
Okay, so we've known about it for quite some time. And I know myself, when I'm doing the intakes, people are coming in regularly and expect me to know everything about all the stuff that they've researched.
Right.
And I don't always, I must say. But the lysine one is one that comes up quite a bit. And so it's seemingly most known to be related to me, to my understanding, from patients and from background in nutrition to the herpes that you put, the cold sores and things. And it seems to have a benefit.
It does. And really what they're finding is that, so most of the studies done on lysine relative to cold sores have been extremely positive. There are a few that were negative. The ones that were negative, basically they didn't use enough of the lysine. So there's a minimum dose you have to use in order to get a therapeutic effect. And then I have seen that clinically, which has been really cool with some of our cases lately, where I was using a certain amount and then I doubled that amount, and then all of a sudden everything changed. And we're not just talking subjective here on a lot of these things that we're going to talk about. We have objective findings to substantiate a dramatic change. People have been suffering for close to a year. All of a sudden in 1 week, everything's gone because that lysine really worked for shutting off the virus better than the results that they had seen being on medical antivirals, frankly. So we're not saying lysine's better than antiviral medications, but in certain circumstances, we've seen it to be. So,
and why would you pick? Why wouldn't you pick a natural over?
Right, and that's what our patients are always looking at. You know, we work in an integrated approach with 2DOs.
We're not anti-medicine, as those of you watch well.
Frequently talk about. We write letters to doctors all the time. We try to be on the team of your physicians. But a lot of our patients are coming here looking for more of a natural approach, as you're saying. It's neat as we go through time because we're getting more and more of these therapies that don't need or require a medical intervention. So we used to refer patients for these antiviral medications pretty frequently. Now with what we're seeing in the last couple of weeks, last month, I'm thinking we're not going to need to do that as much.
Nice.
Yeah.
This is the first I'm hearing of this. But I don't know if you can tell, we're both a little bit quiet today. We're both going through a little bit under the weatherness here today.
Yes,
but we're both recovering, if you will. So so if we're not our usual jovial selves talking about people who are eternally sick, then that's why. Lysine but chronic fatigue. Okay, so we talked about lysine and herpes simplex, but let's talk about lysine and chronic fatigue. This to me is very exciting because we are sitting here in Reno, Nevada, which is just down the hill from a most unbelievably beautiful place called Lake Tahoe, and an unbelievably little beautiful town there called Incline Village. And Incline Village, there's a doctor whose name I'm not going to mention, who kind of discovered, if you will, Epstein-Barr virus and said that it is causing chronic fatigue syndrome. And for many, many years, the idea was to kill that virus. And I happened to live in that village for a long time. So I knew a lot of his patients. I'm not saying anything bad about this gentleman. He was onto something in a sense that the Epstein-Barr virus was related in some instances to fatigue. And but the approach was medical, and rarely did I see patients getting better. It came down to managing symptoms. As I stated earlier, when we have people come here with fibromyalgia, peripheral neuropathy, any type of problem that they've had for a long time, they're pretty worn down. They're fatigued. And when we look at fatigue, we look at thyroid first, we look at blood sugar problems, we look at stress, and we look at digestive bowel problems. We will do it. We do a very, very comprehensive workup, lab workup, and we always check for the viruses, because the viruses can contribute to chronic fatigue.
Right.
Sometimes in a direct way, sometimes in an oblique way, relative to the thyroid. Okay. And this is very exciting because we walk our patients through a very organized procedure. And let's say they come in and have fibromyalgia, and their pain is going away, their weight is going down, their hair is coming back, their feet are feeling better. But then you get kind of to the second phase and they're still tired, and they have a positive Epstein-Barr virus. That might be a player, and I'm sure you'll explain this a lot more detail. And now you're telling me we actually have a pretty powerful tool to deal with that at that point.
We do. We really do.
Yeah.
And so, as Dr. Rutherford is saying, relative to fatigue, it can be like 8 different things as possibilities. We find some patients have Hashimoto's thyroiditis, where they have an immune system condition to their thyroid. They didn't know they had it because it's not commonly tested.
Undiagnosed or mismanaged.
Yeah. And then we also find a lot of patients who have hypothyroidism, where their inactive thyroid hormones are normal, but their active thyroid hormone levels are low or borderline low. That can be significant to fatigue. We have a lot of you out there who are under stress all the time. And so that perpetual stress mechanism can create fatigue in our experience through depleting the adrenal glands. Some of you do have intracellular infections like Epstein-Barr virus or cytomegalovirus, or you may have a pseudobacteria like mycoplasma or chlamydia. And so these intracellular organisms can basically have a party inside your cells, and then they use your energy producing systems for them. And then lots of times that can break down your energy producing systems, termed the mitochondria. And in that sequence of events, then now you have this unrelenting fatigue. And many patients have everything we just described, on top of gut dysfunction, which can also create fatigue in terms of bacterial influx, pieces of bacteria. So we, Epstein-Barr virus, we did a whole broadcast on it. But let's say, as an example, that you have all these pieces, and as Dr. Rutherford said, we fix the thyroid, we work with the Hashimoto's, we get working on the adrenals, we work with your gut. You're doing better, but you're not all the way. The Epstein-Barr virus is a herpes family virus, so it's in the herpes family. And we have seen clinically, and this is not talked in the literature, but I'm just going to tell you what we see, and we've seen quite a few of them now, where the whole thing with Epstein-Barr virus is getting your immune system to recognize it, and then also to slow it down in terms of its replication. So one of the key things there is vitamin C for your immune system to recognize it, as well as high doses of vitamin D. Those things have been shown to get your immune system more competent so that this Epstein-Barr virus doesn't keep evading the immune system. We've employed lysine now, and we just had a gal yesterday from San Diego. She's doing incredibly well over basically the last month since we put her on the lysine. We had handled all those other things. I can't tell you how many things we've handled. And then the lysine was the linchpin in terms of her feeling better. We've had other severe cases this winter with recurrent Epstein-Barr virus infections, where once we added the lysine and D combination, things have all of a sudden kicked into gear and the person is dramatically better. And so from that, we can speculate that the lysine is basically decreasing the viral replication of the Epstein-Barr virus, and hence why we're seeing some pretty cool changes
in the chronic fatigue.
In the chronic fatigue.
Okay.
Patients.
Okay, I just wanted to make that
clear.
Absolutely. And but what and let me just say, Doug Gates made a point of that in that particular case, you cleared out a lot of other things first.
Right. Right. And I feel that's really important, because a lot of you out there suffering chronic fatigue, you want it to be one thing. You want your chronic fatigue just to be lysine.
Right.
You know, it might be that, but in our experience, it frequently is not that simple, just because there are typically 1 to 8 other things going on in your physiology that are causing you to be fatigued all the time. It's not normal to be chronically fatigued. But if you have that, then a series of biochemical pathways are broken down in your physiology. And everything has to be assessed in our experience for this to be successful.
Yeah, so it's being used as a tool, a direct tool for handling the viral effect on the system. But it's really part of an arsenal. And I just kind of wanted to bring that out. maybe for the herpes simplex, but most folks who have this have some sort of an immune issue going on. And so if you already have an immune issue, or you're already stressed out of your minds and your brain's going like a million miles an hour, 24 hours a day, you'll tend to get these herpes simplex infections more frequently. It decreases your immune system, but that keeps coming back to your immune system. So you kind of have to look at everything relative to your immune system. So if you're having chronic fatigue and you try the lysine and the vitamin D in high doses and it doesn't work, it's because there's other things there. We just want you to know there's a tool there that's available to those people who know how to use it and when to use it. That's a non-drug tool for chronic fatigue, herpes simplex. And we do a lot of dizziness, balance, and vertigo problems. Dr. Gates kind of cut his teeth on dizziness and vertigo and balance problems and migraines, what would you say?
Yeah, really on.
Dr. Carrick, who we want to acknowledge,
Yes,
for developing a lot of the techniques that the board certified chiropractic functional neurologists use. But there's an ongoing understanding of what's going on, and vestibular neuritis is something we kind of see sort of semi-regularly.
It's very common.
Yeah.
And so the most common condition causing vertigo technically is when the room is spinning around you. There's an illusion of motion. That's what you have to have for vertigo. Dizziness is you just kind of feel off. And so Bppv, the infamous Bppv, stands for benign paroxysmal positional vertigo. That's where you lay down in bed, all of a sudden you get vertigo, then it goes away after about a minute and you don't throw up. That's the most common form of vertigo.
You know it is. That doctor told me I got these rocks, crystals in my ear that they're not where they're supposed to be. That's usually.
And they told me to go home and do this maneuver.
Yeah, and they told me to go home and do this.
Yeah, that's the term.
And it didn't work.
Yeah. And then the second most common cause of vertigo in this country is vestibular neuritis, also sometimes referred to as vestibular neuritis. And that is where basically the vestibular nerve stops working, specifically the superior vestibular nerve. We have done a couple of broadcasts on this, but just to summarize, there was a fantastic article out of the journal Immunology Research in 2014, where they really went in and examined this whole topic of vestibular neuritis. And they actually went in and did some autopsy studies on people who had died, who had had this condition, so they could look at their vestibular nerve and what was happening. With vestibular neuritis, just so you know, that's where a person gets sudden onset vertigo. They don't have any auditory symptoms, meaning they don't have ringing in their ear, they don't have pressure in their ear, they don't have hearing loss. And so it's all vestibular. Vestibular is our motion sensor in our brain. And so frequently they vomit. This can go on for days, weeks, months, years. We have one case going right now where she came to us, she'd have it for 7 years. Yeah. And it's a really horrible condition to contract in essence. And so the current research, let's back up. So in the 1860s with vestibular neuritis, they started seeing it in families. And so they thought that it was contagious. In some instances, it is thought to be contagious. And the current literature is saying that it's probably a herpes simplex virus that is invading the inner ear. And then the immune system is trying to kill that virus on the nerve. And in the series of events that happens, the immune system starts killing the nerve. And so they call that sometimes molecular mimicry. Now vestibular neuritis is known as being an autoimmune neuropathy. So the immune system is killing the nerve because of the virus. And so the standard medical treatment thus far has been to give people antiviral medications. And then if early in the course of things, they'll give them prednisone, which is, let me say it this way. Sometimes they'll give the person prednisone. Prednisone is highly recommended in the early stages to calm down the inflammation. We have seen a number of these cases. Unfortunately, with dizziness, if you have vertigo of that nature, commonly you're going to go to the ER. And at the ER, they're just making sure you don't have a stroke or a brain tumor. Right. That's their job. Once you're clear of that, they say, you got vertigo, go see the ENT. And some ENTs are more interested in this than others. And sometimes it can take 3-4 months to get into an ear, nose, and throat doctor. And so we've seen a number of cases.
For sure.
Yeah, where a person is out there floundering. We're working with their GP. Their GP may be abreast of the recent and current information. Their GP may not be too familiar with the current information. And so they may be a little reticent to start treating this person because they're not even sure what's going on. So out of this, we've kind of had to pioneer our own strategies, and that's where we started using lysine in these cases. And our first case of vestibular neuritis, and we can say objectively, we can show this because we pop these goggles on their eyes. They're called VNG goggles. Your ENT will use them. And it really records the eyes. And when the person's not looking at something, their eyes are moving back and forth. It's called nystagmus. And the first case just blew me away because we put her on lysine, and all of a sudden, a week later, she stopped having nystagmus. And she had had this started in October, and this was probably about March. So quite a few months, going on 6 months. And so pretty much an instantaneous change. We just had a case last week where this gal had had this for now about 10 months, disabling. Her next step was basically to go to Sacramento and have her inner ear drilled out.
Oh, okay. Yeah.
And she's a high functioning gal, high powered job. And so we put her on the lysine. We didn't see much change, but then we doubled the dose up to a higher dose, which is now in the literature.
That's why she was smiling when she
discussed as being pretty effective. And so I popped the goggles on her last week. All of a sudden, the nystagmus that she's had for a long period of time, and she's not taking her Xanax. She didn't take her Xanax that day. Her nystagmus was gone, which is really profound. Because if anybody has ever had vertigo, you know how awful it is. In fact, I've had doctors tell patients, man, I had vertigo for 3 days. I don't know how you've dealt with this for however long, 10 months or 7 years. And so lysine there, I mean, we should write up these cases because these are pretty awesome. So we've seen lysine really help vestibular neuritis.
I think you should do that in all your spare time.
I know, yeah, because I have so much of that.
Yeah.
I'd have to cut out my 2 hours of fun on Saturday.
There you go. Yeah. So vestibular neuritis, which I was just introduced the fact now that it's autoimmune. I keep learning new things. But again, this is why we've kind of mushed our disciplines together. Dr. Gates's discipline is the neurological area. And, Meniere's is also autoimmune.
Mm-hmm.
Now it's like everything's immune now. Now, I'm grossly generalizing, but I mean, we're coming down to our entire patient population seems to either have autoimmune problems or the infamous fight, flight, post-traumatic stress syndromes that they seem to combine and create this insanity in the body that creates this eclectic number of seemingly unrelated symptoms, and technically they're not. Technically, there are a variety of different things affecting those two areas. And here we are in the ear again with another inflammatory immune issue. And these are horrible. I mean, these folks come in, they're disabled. And it's just, and lysine. And did we talk about D? Did we talk about vitamin D?
We did in the Epstein-Barr virus broadcast.
Okay,
I mean, we haven't
really,
we referenced high doses. We can't tell you to do anything out there because you're going to do something and then you're going to take a way high dose. You're going to take it forever and then you're going to blame us.
Right.
And so in a controlled environment, vitamins can be used in mega doses, but they have to be under the direction of a physician, and the person has to be watched in terms of their physiology.
Because we use some high doses.
Yes, we do.
And it works. And it works. When Dr. Gates says a controlled condition, we tell our patients, most of our patients end up with vitamin D by the time we're done because they'll have autoimmune problems, and you can look our other stuff up on that. But a lot of the things that Dr. Gates is talking about using, he's not talking about using forever. And in this particular case, are you talking about long-term lysine use?
No.
Just to get them through that stage. Wow. So, and then there's some new stuff going out there on lysine with HIV.
Yeah, so it's now being discussed. Basically, the pharmaceutical industry they're on to this. So just so you know, there's no money in talking about lysine for these conditions.
Right.
Nobody's going to make a lot of money because it's not patentable. But that's where the pharmaceutical industry comes in. They see the potential of lysine, and so they chemically will use lysine derivatives, lysine attached to a chemical compound as a new antiviral strategy. And those are now being discussed for HIV, also for foot and mouth disease. Some people call it hand, foot, and mouth disease. And so pretty exciting, frankly, a number of things. And now Alzheimer's. So, yeah, exactly. So now they're finding what the look.
I was gonna say, what doesn't affect the brain?
Ah.
Stress affects it, inflammation affects it, blood sugar affects it, everything in the gut affects it. It's like,
Yeah.
no wonder we got Alzheimer's.
And one thing we're finding with Alzheimer's is that there's a high association of herpes simplex virus infiltration in the memory area of the brain.
Okay.
And so now lysine is being discussed as a novel treatment strategy in the early stages of Alzheimer's to eradicate that herpes simplex virus infection.
Actually just read that.
And then that could potentially really help some people. So that's another avenue. We've also discussed relative to Alzheimer's, the current literature is saying that it's diabetes type 3. So it's a type of pre-diabetes that can predispose you to the biochemical process of developing those tangles. They're called neurofibrillary tangles in the memory area of the brain. Also, stress hormones are now being shown to have importance in the pathogenesis of Alzheimer's, as well as inflammation. So some of the best things that you can do, and this came from UCLA, I don't know, a year ago, they basically took 10 patients who are developing Alzheimer's, like they're in Alzheimer's, but the early stages, put them on a blood sugar diet, anti-inflammatory diet, all 10 improved, such that they no longer had Alzheimer's.
Did they look at MRIs or just?
I can't remember if they did or
Yeah.
not, but you know,
There's studies of that nature, though.
I went to a speech by a neurologist. He was here in Reno. Now he's in Vegas. He was given $70 million for an Alzheimer's treatment center. And at that time he said, this was 2009. He said, the only thing we really know is that you should exercise and the medications don't work once you get Alzheimer's. So for anyone who has a genetic history of Alzheimer's in the family, you're concerned about it, read that study from UCLA and really look at an anti-inflammatory blood sugar diet.
So the topic was lysine and antiviral properties, and specifically related to herpes, chronic fatigue, herpes simplex, chronic fatigue, and vestibular neuritis or neuronitis. I know I have to think people are out there thinking, okay, so is this something I should be taking all the time? Is this something I should be taking on a maintenance dose, or is this something along those lines? Epstein-Barr, and let me add something in as to where my thinking's going on. I mean, Epstein-Barr virus and Coxsackie virus, and they're like everywhere.
Right.
I mean, if you take 100 people off the street
them.
and you test for them, a lot of people are going to show up as having Epstein-Barr virus who don't have any symptoms.
Right.
So, and I'm assuming some people out there may know that. So
Okay,
are
gotcha.
you, just a question.
Absolutely.
Question I think
So
might be in the mind.
I think that's a great question.
Save you answering one on the email.
Yeah, right. So with the Epstein-Barr virus, all of us pretty much have been exposed to it, 95% of us, by the age of like 30 or 40. And so with that, there are ways to test for Epstein-Barr virus, and certain blood tests will show that you've been exposed to Epstein-Barr virus, whereas other blood tests are more specific for a re-aggravation of the Epstein-Barr virus. So those are the tests that we use in clinical practice. We're looking and we're saying, okay, you actually have Epstein-Barr virus again. Your immune system is fighting it. It shouldn't be doing this, even though all of us have been exposed to it, and we'll have antibodies to it in another form. And so relative to chronic use of lysine, lysine is discussed in the herpes literature. You know, those who have oral or genital herpes to take lysine on a regular basis. Overall, it seems safe. There was one reported effect I saw in the literature where somebody developed basically a kidney problem, pretty serious kidney problem from taking lysine. But other than that, it appears to be pretty safe.
Okay.
Yeah.
Well, I think that should do it then.
I agree. I think we pretty much have covered it.
So that's it. Normally I say if you have any questions or answers, but we're going to have to start pulling the plug on the questions. Well, we are spending a lot of time answering his questions. Love to do it, but we have a thriving practice here, and a lot of paperwork, a lot of things to be done, and it's starting to get to the point where it's becoming very difficult to return these. So I'm not sure where we're going to.
And I was sick last week, so anybody who sent me a question last week, just know that I will get back to it.
Yeah.
I just was not feeling well last week, so I've been behind.
Yeah, and he gave it to me, so I'm not
almost
feeling well
caught
this week.
Yeah.
So anyway, but we're doing pretty good, and so just hold the questions for the moment. Okay.
Yeah.
So we can catch up on everything else that we're doing. So okay, until next week. Thanks for watching, and hopefully we'll have another interesting topic. Okay.